everyone. In today's lesson, we will learn some nursing terminologies related to vital signs. Now, vital signs measures our body's basic functions, and it includes our blood pressure, temperature, oxygen saturation, pulse rate, and respiratory rate. Taking the vital signs is always the first step of any medical exam or evaluation. Say if you feel unwell and you believe you're sick, the best way to check your health is to check your vital signs first. And if all these vital signs results are normal, then that means your physical health status is stable. You don't need to worry too much. But if any of these vital signs result is wrong or not normal, then you have to be concerned and take further examination to find out anything wrong with your body. All right. So vital signs are important because they give the doctors and nurses some clues about any underlying conditions that could affect your health. Okay, so let's talk about the terminologies related to the vital signs. So firstly, the blood pressure. Okay, blood pressure. Now in medical field, if some result is high, we can say hyper, and if the result is low, we can say hypo. So if you have a high blood pressure, we say hypertension. So hyper means higher than normal. Tension means the pressure. So hypertension means high blood pressure. Now, what is blood pressure? So blood pressure is the pressure exerted by the blood on your blood vessel wall. Remember, the blood flows inside your blood vessel, and when the blood flows through your blood vessel, it will exert the pressure on the blood vessel wall. Okay, so the pressure is called tension, and high is hyper. So hypertension means high blood pressure, and hypo means low. So hypotension means low blood pressure. Okay, very good. Next one, the temperature. Say normal person's temperature should be between 36 to 37. Say if your temperature is above 38, like that's definitely a fever. So in medical English, when you have a fever, we can say hyperthermia. So thermia means temperature, hyper means high. So hyperthermia means high temperature, means you have a fever. And if you have a lower than normal temperature, we can say hypothermia. Hypo means low, thermia means temperature, so hypothermia means lower temperature. There are also other ways to call the fever. We can also say febrile. So febrile also means a fever. We can also say pyrexia. P-Y-R-E-X-I-A. So pyrexia also means fever. So you can say there are different ways to call a fever. Yeah, fever means high temperature. So we can say hyperthermia. We can say febrile. We can say pyrexia. Now, if the temperature is low, we can say hypothermia. Now, if the temperature is normal, so if this person doesn't have a fever and is normal, we can say afebrile. So A means absent, febrile means fever, absence of fever means no fever. So that means that is afebrile. Say sometimes if we put a word if we put like a in front of a word, that means absent. That means no. Yeah. So afebrile means no fever. Yeah. Remember this. Now next one is the respiratory rate. Respiratory rate. So respiration means your breathing. So respiratory rate checks your breathing rate. Now, normally our breathing rate should be between 12 to 20 times per minute. So every minute we should breathe around 12 to 20 times. If our breathing is too fast, that's not good. That means our body needs more oxygen. So if our breathing rate is too fast, we can say tachypnea. Tachypnea. Tachy means fast than normal. Tachy. Pnea means breathing or respiration. So tachypnea means fast breathing, above 20 times per minute. Now, if the breathing rate is lower than normal, like lower than 12 times every minute, we say bradypnea. Brady means lower. Pnea means breathing. So bradypnea means lower breathing rate or respiration rate. So again, another way of saying fast and low. So fast is tachy, low is brady. Yeah, faster, tachy, lower, brady. Tachypnea means fast breathing. Bradypnea means low breathing. Now, if we have shorter breaths, so like really struggle with breathing and breathing rate is not normal, we can say dyspnea. Dyspnea. So dyspnea means abnormal breathing. So like the breathing rate is not normal. It's not regular. It's like sometimes you feel shorter breaths. That's dyspnea. Now, if you temporarily stop your breathing, like especially in during the sleep, some people have the sleep apnea. So apnea means temporarily stop the breathing. So the breathing stops for a short while, for a short period. So this is called apnea. So ap means no, pnea means breathing. So if there is absence of breathing, that is called apnea. Apnea. Okay. So tachy means faster, brady means lower. Okay. So fast breathing rate, tachypnea. Lower breathing rate, bradypnea. Absence of breathing, apnea. Shortness of breath, irregular breath, that's dyspnea. Okay, now next one I want to talk about the heart rate or pulse rate. Heart rate. So heart rate means how many times your heart beats in every minute. Yeah, so normally your heart should beat 60 to 100 times per minute. Okay, so your heartbeat should be 60 to 100 beats per minute. If your heart beats faster than 100 times per minute, that's too fast. If your heart beats less than 60 beats per minute or even less than 50 beats per minute, that's a bit low. Okay, now if you have a fast heartbeat, we call it tachycardia. Tachycardia. Now, in medicine, cardia means heart. Yeah, cardia means heart. Tachy means fast. So tachycardia means faster heart rate. Brady means low. So lower heart rate is bradycardia. 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 So cardia means your heart. Okay, bradycardia means lower heart rate. Yeah. Now, if you are sick and if you are not well, your body gonna show some symptoms. Yeah, symptoms. For example, you feel a bit short of breath, you feel dizzy, you are sweaty, you're anxious, your temperature rise and you feel like chills, or hot, like just different. There are some different symptoms. So symptoms will show if your body is not right. Okay, so it's very important if we want to know whether a person is sick or not. It's very important for us to observe their symptoms. Yeah, see what symptoms they can show and to see if anything is wrong. So if a person has symptoms, we can say this person is symptomatic. Now, if the person doesn't have any symptoms, we can say asymptomatic. A means no, means absent. So if we put an A in front of a word in medical field, that means normal. That means that means absent of something. So asymptomatic means no symptom. Okay. So if the results are normal, we say normal. If the results are not normal, we can say abnormal. So we put A, B in front. Ab means absence. Yeah. So if it is not normal, we say abnormal. If it is normal, we say normal. If it's not normal, abnormal. Okay. So now and the last part of the vital signs is oxygen saturation. Now, oxygen saturation means the amount of hemoglobin that is combined with the oxygen in your blood. So inside our blood, there's a very important protein called hemoglobin, and hemoglobin is responsible for carrying oxygen throughout your bloodstream and deliver this oxygen to every part of the body, because every part of our body relies on oxygen to survive. Okay, so oxygen saturation detect how much hemoglobin can be bound to oxygen and then carry this oxygen to rest of the body to supply energy. Okay, so our normal oxygen saturation should be between 95 to 100%. So the unit of oxygen saturation is percentage. Yeah, percentage. So when the hemoglobin is bound with oxygen, this will show the percentage of this bonded hemoglobin inside your blood. Yeah, so this is called oxygen saturation. So the normal level should be between 95 to 100%. Yeah, percentage. Okay. So that is some common terminologies related to our vital signs. And I hope you can learn these important terminologies and understand what do they mean. Okay, thank you very much for listening. Thank you.